you, ma'am.
And here is your question. Right. So if you have read and understood, considering it history taking session, kindly begin.
Hello, my name is Dr. Prabjit Singh. I'm one of the surgical doctor here. May I confirm your name and your age, please?
It's John, 56-year-old doctor.
Nice to meet you, John. Today, I've been asked to ask you a few questions regarding your problem, and you can totally confide on me. The whole conversation will be confidential. Are you okay with that?
Okay, doctor.
Okay, so I would like to have a chaperone for this scenario.
Yes, provided.
Okay. May I know what's the problem which brought you to?
Yeah, doctor. No, I don't know how should I really express it. Like from where it's quite embarrassing. So
It's okay, John. You can
have,
tell me.
Yes.
I have this problem with my erection, doctor. Like it's been quite some time, like few weeks, I think. You know, it's really worrying me now.
I'm so sorry, John. Could you tell me a little bit more about it? As you said, few weeks. In how much it's being you're having this problem?
It's around 3-4 weeks, I think. I can remember.
3 to 4 weeks. Okay. Can you tell me, did it start suddenly or gradually?
It was gradual in onset, I think.
Okay. And has the problem increased or decreased or remained the same over the time?
Yeah, doctor. Since few days, I think it's getting worse. And, you know,
I'm
very
so
difficult.
sorry to hear that. I'm so sorry. Okay. Do you feel there is anything which increases this problem or decreases this problem?
Not really.
Okay. So you have problem with erection of your penis, right?
Yeah, doctor. Yes.
Okay. So are you having night erections or early morning erections?
Yeah, I think I have them. Yeah.
Okay.
Morning, I have. Yes.
Okay. Okay, John. Are you to perform the sexual intercourse? Are you able to penetrate with your partner?
Sometimes yes, sometimes no.
Okay, John. So are you able to ejaculate?
Yeah, like it's also the same, doctor.
By saying what you mean, do you have a premature ejaculation or you don't have ejaculation at all?
I have, but sometimes I don't.
Okay, I got you. So are you having any pain while performing your sexual act?
No pain. I didn't notice that. No, doctor.
Okay, John. So is there any change in curvature of your penis, change in shape or?
No, I didn't know.
Okay, John. Are you and your partner having sexual satisfaction these days since you're having this problem?
No, doctor, no. That is the main issue here, doctor. That's why I have visited you, It's been very difficult for both of us.
So sorry to hear that. Okay, John, are you having kind of performance anxiety?
course,
feel
yes.
that?
Yes. Yeah,
Okay.
I have
Any-
that.
Apart from anxiety, are you having any kind of stress at home or at your job?
Yeah, doctor. Now, I have this job, and then, it's really stressful. I'm kept busy most of the time, and then, it's really stressful, and then I really don't get time for myself.
Okay, John. So stress from work. Apart from that, are you having any stress in your relationship with your partner?
No, not. We are good.
Right. Okay. Any kind of low mood you are having these days?
Yeah, sometimes because of this thing, like, it keeps me occupied. I don't.
Okay. Any change in appetite recently?
Oh no, not that. No, I didn't notice that.
Any change in sleep pattern? Are you able to sleep comfortably?
Sometimes it disturbs me, doctor, when I think about this.
Okay.
I can't get that.
To hear that. Since when are you married? Are you married? And for how long are you married?
I'm married. Yes, doctor, I'm married. I have 2 kids.
Okay. You have 2 kids, right? So what was the last time you had sexual intercourse with your wife, if that's comfortable to tell?
Yeah, I think it was 15 days back, I think. Yeah, because
And before that, okay. And before that, in the last 3 months, did you have any other sexual activity before that?
You mean with my partner?
Yeah, of course, with your partner before 15 days.
Yeah, yes.
Mm-hmm. Okay. Do you use contraceptives while having sexual intercourse?
No.
Can you summarize your case now, please?
So I would like to complete my history by asking systemic examination, drug history, and allergies and other medical conditions, and if patient is having any drugs. Thank you so much, John, for your time. So
idea, concern, and expectation.
Yes, expectations of the patient. So today, this gentleman, 56-year-old, presented with the chief complaint of having sexual dysfunction and problem of erection. And on the history, the patient is having social stress. The patient is having night erections. I could not ask the patient about history of smoking and alcohol. Apart from that, the positive findings, the patient is married and having 2 kids. And otherwise, he's active and healthy. So my main differential for this patient will be a psychological impotence.
Yes, and
other differentials in this age group could be due to BPH. It could be other organic causes like vascular cause or neurological cause, or
how would you
causes
confirm
like
your diagnosis?
Yeah. So I would like to perform a full examination and complete my history first, and then investigations, which include full blood count, SR, CRP, hematinics, and I would like to get and electrolytes, LFTs, and hormone assays like FSH, LH, serum prolactin levels, and prostate-specific antigen. And in radiography, I would like to get duplex ultrasound of the penis and angiography to rule out the vascular problem, and intracavernous prostaglandin to this is a test to check the vasculature.
So what are the treatment options that you can offer to the patient?
So foremost, the lifestyle modification for the patient. If the patient is having obesity, weight reduction, smoking cessation, and if patient is diabetic, control of that. And apart from that, the other things could be phosphodiesterase 5 inhibitor like sildenafil, intracavernous injection of, and prosthetics, which could be semi-rigid or inflatable.
Good. Okay. Right. Thank you, both of you.
Thank you so
can you
much.
give feedback?
Yes, ma'am. Thank you, Dr. Prabjit. You started.
Thank you so much, doctor.
And you started well off. You sounded confident.
Yes.
And you did try to cover more patients from especially the present complaint.
Yes.
You also ruled out the psychological this one issues and history, and also about the sexual life. In the psychological part, yes, and after that, yes, you did try to cover up the medical history, surgical history, but time was not enough for you. Maybe both of us were slow. I think you were also slow. I was also slow in answering. So a few comments like in the presenting complaint, you covered everything. In the psychological history, maybe I think you missed about the libido and also about the appetite.
Yeah, I missed that. Yeah,
you did ask about the social
appetite
and
covered.
Appetite, yeah.
social stress you covered, and any related you covered. And in the you did mention that if time would have you asked the medical history, the surgical history, and drug history, which are important. And also the personal history also you mentioned about the habits like smoking, important. And if time would have permitted, I think you would have covered them all, I feel. Management, investigation, treatment, I think you mentioned well. Thank you.
These are the good things.
Thank you so much.
What he could have improved, that certain questions during presenting complaint, he had to ask them twice. He can avoid asking them like double. He can organize and structure his questions like more properly, so that in one question, 2-3 things are covered. So this will save his time, and in the given within the given time, he would be able to complete his history. This is what I felt, because sometimes like he was repeating himself, which could have been avoided if person was more prepared. But otherwise, it was good. At the end, yes, even remembered what to tell. So Dr. Mamoona, yes, please.
Yes, ma'am. History was good.
Yes.
He asked most of the questions, but a little bit slow. Yeah, he repeated, and he also repeated a few sentences just to make sure the patient is what he is saying and what he means. So this is like what the time consumed a lot.
Yes.
So, but if the time allowed, like he was good in the beginning.
Yes. Thank you.
Thank you, Dr. Mamoona. That'll be helpful later on.
Yeah, definitely.